welcome to the latest edition of NurseVerse. This is the podcast for the European Specialist Nurses Organization, talking about all of the different impacts that occur for nurses and for patients. And today, I'm delighted to be joined by PANAGIOTA TSIKALA. She is an expert on the second victim phenomenon. That's what we're going to be talking about today. PANAGIOTA, thank you for joining us.
Hi, Paul. Thank you very much for inviting me today.
Let's get right into the topic. What is the concept of the second victim and why is it important?
So I will tell you now. In Professor Albert Wu, in 2000, he first coined the term of second victim when he wrote an article about a doctor who did an error. And he said that the doctor who makes the mistake, he is also a victim. So this is how things started. Of course, the first victim is the patient and his family. But you can see that the healthcare professional is the second victim because the impact is huge to us. Nobody goes to the hospital, wanting to do a mistake, harm a person. And after that, there is also the third victim, that this is the organization where the healthcare professional works. And of course, now there is a new definition from the European Research Network working on second victims, and it's a bit more. It has all the healthcare professionals. It includes all the healthcare professionals, and it is about any healthcare worker directly or indirectly involved in an anticipated adverse event, unintentional healthcare error or patient injury, and who becomes victimized in the sense that they are also negatively impacted. There are many negative feelings that a second victim can have after an adverse event.
Sure. How did you become interested in this topic?
Well, I am the last 3 years, I'm a fellow with the International Society for Quality and Patient Safety. And I think 2 years ago, I received an email about an online training about the second victim. And I said, wow, what is this? So, of course, immediately I had to do it. And I was really fascinated of that concept. And after I started reading more, and I found it I found it really important because, I work as a nurse 22 years and I have been there, me and my colleagues and other healthcare professionals, not only nurses, not only doctors. The hospital is you can imagine, it's like a small, it's a community.
Yeah.
And everybody there, they have some things to do, some duties, and everybody can be a second victim.
Right now, when, let's say, something happens, a nurse makes a mistake, what type of support is there for him or her when this happens?
Look, I think there are globally five of these centers who offer support. The best support for a healthcare professional who becomes a second victim, according to the research and the literature, is the peer support.
Yeah.
So I am really lucky to say that here in Vienna, there is, in another hospital, not in the hospital where I work, there is a program. It's called COHI, Collegiale Hilfe, and the nurse who does an error, a mistake, or something like that, can go there and receive support. Of course, we are still in the blame culture. We haven't reached yet the just culture, where you can openly talk about something, not being afraid that there will be consequences.
So is this whole topic of just culture, is it all very much linked to the second victim? Is a different way of understanding how medical professionals work?
I did not get exactly your question now.
Is there a link between a no-blame culture and just culture and this concept of the second victim?
Of course, because when you do a mistake, you have to feel free. You have to feel psychologically supported from your organization that you can talk about that. You can talk about that. You can see why the mistake happened. How do I feel after that? Of course, our main focus, our main concern, of course, is the patient. I don't take, the focus from the patient, but if you want to offer quality, if you want to work safer, you need to take care of your healthcare workers. You cannot work in a blame culture when something happens and you try to hide it. How can you improve if you don't take your mistakes as learning opportunities?
Is this concept of the just culture, is it evolving? Is it catching on? More people are becoming aware of its importance?
Yes, of course. This is where we would like to be, in the just culture, where you can talk about mistakes, where there is the open disclosure, where there is the peer support, where there is the psychological safety for healthcare workers. We talk about healthcare systems, but what is a healthcare system? I mean, what is it? Is the papers, the computers, the buildings, what? There is a huge amount of people working there. And yes, there are, of course, the doctors, there are the nurses, but there are also the people who take care of the cleaning of the hospital. There are many different kind of professionals in a hospital that all of them should be involved in a teamwork and in a team training. I was reading the other day in a paper that said that if a team is not connected well, is not performed well as a team, there is a bigger possibility for errors to happen.
Sure, that makes sense. In the research that you are doing now, what sort of topics are you trying to explore?
So I decided to translate the German version of the questionnaire about second victims in Greek, because I come from Greece.
Yep.
And I will focus on all the healthcare professionals, doctors and nurses. And I would like to see their perceptions about second victim, because it's not really widespread as a concept, and how they feel, and how could we create another support system.
Yeah.
And I will try to include nurses from Greece, from Cyprus, because both countries speak Greek, and also from English-speaking countries.
Okay. Are you also interested in doing more to establish peer support networks?
Yes, there is a training in October here in Vienna that I will going to take part to learn how to do peer support. And my next step is going to be my PhD, that it's also going to be about the second victim phenomenon, about nursing and how nursing is related to patient safety, and why should we include the patient safety in the training of nurses, in the nursing school.
Could you develop that a bit further? Tell us a bit more about the link between these concepts and patient safety. For instance, where you have organizations that have a just culture in place, is there research showing, with respect to the outcomes for patient safety, that they will be improved?
Yes, the healthcare professional's well-being is directly connected with the patient safety and the concept of the second victim. Because when you feel like you can talk about your mistake you are avoiding all the negative impact of the second victim. We see many healthcare professionals that they abandon the profession. They cannot stay there anymore, or they have burnout, or they feel overconfident, or they feel like that they are not enough, or they are depressed. And it's really difficult to share these feelings because I can share that with my colleagues to a certain extent, but you need to feel supported at any moment to talk about a mistake and try to learn. As I said, a mistake can be a great learning opportunity, so we can avoid it later.
Yeah, and you create this culture where there's a focus on improvement. Whenever there is a mistake, it's an opportunity to improve the whole system and improve the outcomes for patients.
Of course, I worked until now in 4 different European countries. And sometimes, when you are in your country, you say, oh, in Europe, in other countries, it's different. Well, everywhere is the same, I have to say, for us nurses. And for me, I really would like to help, to support, to create a better conditions for nurses to work, better teamwork. The middle management, the healthcare managers, that the first level of management really needs a lot of work.
What advice would you give to somebody who is interested in this concept, new to it, for instance, would like to set up a peer support network? What's the best way to go about this?
Well, there is a whole concept. There is we had the training school. It was the 4th year in the European level. And there is also here in Austria is a very innovative project. There is this organization is called Second Victim, where the doctor, she is an anesthetist, a doctor. Her name is Eva Potura. She is a very innovative lady. She created that Second Victim Association, and I am a member there of the scientific committee. And I think this is a great idea for other European countries also to follow and create a European network where we can learn from each other and we can create more supporting projects and systems for healthcare professionals. And we also, we also need to include the patients. Because
how would that work?
I think we were talking about patient-centered care. Of course, the patient is the main focus for every healthcare professional. But now there is a system, and the patient is a part of that system. The patient needs to be informed and actively also decide for his health. He also needs to know how this system works. We are nurses, we are healthcare professionals, we are front-line healthcare professionals, we are scientists, we are professors, we work in the government, we work in different positions. We're not heroes, we don't need anybody to say, oh, bravo. No, this idea, these stereotypes, they really need to change. And we are humans. We are humans, we need a human-centered healthcare system that cares and that takes care of everybody that belongs to that system.
Tell us a bit more about your vision and what you would like to achieve in a general sense.
Well, what I would like to achieve is that I really would like everybody to understand what nursing means in the reality. Because, as I said, we have connected nursing, with some things that they are, I think, old, or I don't know why they remain like that. And I would like nursing to have the position that it deserves in a healthcare system. We are scientists. We do a great job. We can really have a great impact in the healthcare sector from many different points, that a nurse who works in a unit can also be a researcher, can also do many different things about nursing. And I think, yes, we need to take care of our nurses, because we always talk, we don't have enough nurses, we don't have enough nurses. But how is the feeling when you are a nurse? In some departments, it's really hard.
You're involved in many different associations,
Yes.
and I guess associations are a part of this as well. To take ESNO, what role do you think that ESNO can play here?
ESNO is a great organization who supports and really tries to make an impact about nursing. And I believe, I know that ESNO can play a very crucial role on the patient safety, on the second victim phenomenon, and with collaboration also with other organizations and other stakeholders.
Yeah. I guess one of the most challenging parts of this is healthcare professionals who experience this, who are in fact second victims, but find themselves in a context where there is in fact a blame culture in place, and that they are afraid of being blamed and so on, and so naturally reluctant to share their experience for the sake of improving things. I think this must be one of the most hardest situations to be in.
Yes.
It's for somebody, and I guess it's not uncommon. For somebody in that position, what advice would you give?
For somebody who is a second victim,
Yep.
and works in an institution with a blame culture,
Yep.
well, this is a very hard advice to give. I mean, it depends. If the person works in a private sector and the person is afraid that they are going to lose their job,
Yep.
and they have a family, they're supporting their family, I don't know. It's really difficult to say. Personally, if you ask me, I would say speak up. Be a part of the change. Nobody is going to change things for us if we don't do it. Who is going to do it for us? Are you going to come from your home and tell me, look, Yota, I'm going to change these things for you? No. And there is, things to change. Sometimes we need to be brave and we need to take some responsibility. It's not easy, I know. I know very well. But things will not change differently.
This, I guess, is something as well that you learn with experience.
Yes. Well, I mean, many different countries, many different languages, mindset barriers, a lot of things.
And, it seems from, a lot of the things that you're saying that there's still this experience where nurses are just considered a number within the health system, just a cog in the machine. Would you say that's a fair assessment, or are things changing there as well?
Well, I would say that things started changing, but we're not there yet. There are many places, and I have experienced that yes, nurses are just a number, are just the boy that I said to you.
Okay. Tell me about that.
About the book?
Yeah.
Well, there is this book, it's called, how we call it, Invest in Nicht Neues, All Quiet in the Western Front.
Yep. I haven't read the book. I saw the film.
Well, the film is not so good.
Yeah, I heard.
That book, I had it since I was a child. First time I read that book in Greek.
Okay.
Now I have it in German because I kind of speak German, so I would like to read it in the language that it was written.
Yeah.
And, in that book is the First World War, and there is a young boy who is a soldier there. And at the end, he gets killed. It's probably the last page of the book. And after you have the report from the day, like what happened today in the Western Front, all quiet. We talk about a human life, but they were numbers. And sometimes the same thing happens with us.
Okay. Well, I think that you're doing a huge amount to try and address this. I think that a part of this is awareness raising, and to let people know that there are peer support networks in place. There are a range of associations who are working on this topic. There's a lot of research in this topic. So, there are a lot of ways to get involved and, as you said, be part of the solution as well. So I think linking up with ESNO can be a good start. PANAGIOTA, it's been fascinating speaking with you. I really loved learning about this topic, and thanks for joining us today.
Thank you, Paul. It was really nice.
Thank you.